Okay, guys, so we'll be looking at a particular stuff which is usually seen in what some tests that are like maybe some blood tests that are basically done in orthopedics. You see that the levels of white blood cells are actually getting high. So that's what is known as leukocytosis. So as related to orthopedics, we'll now be looking what are the disease conditions that are likely to make it that your white blood cell count will usually shoot up. Okay, so leukocytosis, this is how the blood film will be looking like. So in leukocytosis, just have to do with an increase in white blood, the numbers of white blood cells. Okay, and the cells are actually getting above 11,000. Okay, so it's an important sign. It shows that there's something underlying that's actually making those white blood cell their numbers to actually shoot up. So what's their meaning? Normal roles of white blood cells is just to defend against infections, respond to tissue injuries, So leukocytosis shows that the white blood cell count is actually elevated. So it's typically due to what? Bone injuries, joint injuries. We'll get to look at the causes, right? So it's not a diagnosis on its own. Okay? You combine it with other things you are actually noting to now make a final decision. I don't know if you understand. So that's how that one actually goes. Now, causes of leukocytosis, it could be bone infections like all those osteomyelitis. So white blood cells are coming up so that they can fight the bacteria. It could be joint infections like all those septic arthritis. It could be post-surgical infection. So after a surgery, infection set in. It could be fractures. It could be trauma. It could be inflammatory conditions like all those rheumatoid arthritis, gout, and other autoimmune disorders. Okay, it could be prosthesis-related infections. Okay, so clinical use. It gives you an idea that there's something going wrong. All right, and after you are even treating the patient, you are still doing the test because you want to see how the level is going down. You understand? So you combine it with other tests like all those erythrocyte sedimentation rates, blood cultures, joint aspiration, Then of course, orthopedics is not complete without imaging.